Hello everybody, welcome to day 3 of Waxvent. My fingers at them. My name is Taylor Green, I'm one of the audiologists here at Audiology Associates.
My name is Rhys Taylor, I'm the other audiologist here at Audiology Associates. Combined effort on this one.
Yeah.
I think it's you that starts it off.
Oh,
I don't know mind, but we both had a go at this one. Difficult one, wasn't it?
Yeah, very difficult one. Like one that, again, one of those kind of patients that has a very deep sort of prominent recess there, where, you know, all this thick skin. Again, I think all three of them pretty much has been keratin so far.
Yeah, that's right. Yeah, we do.
Now, yeah, this particular patient has. Well, I think this was the first time the patient came to us, because the patient actually came back about 6 months later with the same problem.
Exactly the same.
Exactly the same.
Got a very rare condition, this gentleman, and takes some quite strong medication to keep it at bay. The side effect of that is that we get this issue where we talk about epithelial migration pretty much every episode of Waxvent so far, but we talk about this epithelial migration, and the difficulty this gent has is he just doesn't happen in this gent at the moment since he started taking this medication. So what we end up with is this thick, like I mean super thick keratin layer that adheres to both the eardrum and the deepest osseous portion. That os just means bone. So osseous, which is the bony portion of the ear canal. So there are two parts of the ear canal, just in case you didn't know. The outermost section is cartilaginous, so it's surrounded by cartilage, soft and flexy, like your ear is there. And the inner 2/3 then is bone, so bony sections, which are a little bit more sensitive. But you can see, trying to peel this down the canal at the minute.
Like so far, I'm thinking, oh, this is actually coming away nice and easy. It should come away nice and easy. But oh my goodness, it was holding on for dear life. It's
not a nice one to do, is it?
What I was hoping for here is I put a bit of oil in. That's going to get around it. It's going to peel away quite nicely. But I know the patient at one point did feel a little bit of a pull, which is understandable because this is going right over the front of the eardrum. So we've managed to peel away a little bit here.
It says you've peeled a good portion of that drum as well.
Yeah.
My memory serves me right. It's that anterior recess section that is an absolute...
You can see it. I'm pulling on this and it's not going anywhere. Yeah.
But I think both ear canals are exactly the same. And I think you did manage to clear one, if I remember. You managed to clear the one side, but the other side...
I couldn't get that.
Just could not get that lift.
And I think the more I was going in, the more the little bits I was taking away, and I just couldn't get... That's when you took over then, because I got a bit tired then at that point.
It's hard, isn't it? Because you do get to a point where you want to leave enough there. Like if I know I'm going to have to get a patient back in for a follow-up, you'll leave enough there to start with at the next visit, just to make your life just a little bit easier. But you can see how this has gone right down into the recess, and look how thick. I mean, normally when we do an eardrum peel, it's a very thin, it's almost like a skin cell thick, you know, it's a very wispy, very translucent piece of skin. When you get to this and you get these thicker, you know, these are hefty layers of skin you're taking away here, aren't they?
Oh yeah. Camera's actually quite clear there as well. I'm pretty sure I've got a little bit of a blur going on my endoscope at the moment. I'm constantly...
It does tend to happen, doesn't it, with us? I think because we use them so much, they take an absolute battering.
They do take a bit of a battering, to be fair. What I'm trying to do here is bunch that skin up into the suction tube, so that hopefully if I can bunch that in, I should get a much better grip. And that should allow me to peel it, but it is not going anywhere. This is, like I said, this is holding on for dear life, this.
I'll do the explanation, guys, just in case it's the first time you've ever seen one of these videos and you're wondering why we were in these fetching pieces of headgear. This is actually part of a series called Waxvent. We do this every single December for subscribers as a thank you for watching our videos all throughout the year and being subscribers of the channel. They get Waxvent, and what we do is we post a new video with wax removal every single day through December, right the way through to Christmas Eve. And I think Christmas Eve is the last one I think we're doing this
Yeah.
year. So Christmas Eve is the very, very last one, because you guys got stuff to do on Christmas Day. You're busy
Yeah.
people. You don't want to be watching wax removal videos. So yeah, it's basically all the way through until Christmas Eve. You get a new video every single day. So make sure you hit that subscribe button, follow button, depending on which channel you're watching this on. And yeah, like, heart, share, follow, subscribe for us. That'd be absolutely fantastic. There you go, guys. If you really, really enjoy the videos, you want to see even more videos, then you can actually become members of the channel. That way then you get to see even more videos as well. So have a little think about that.
Oh, we're getting there slowly.
It's
and
pulling out, isn't
it? We're getting there. We're getting there. But you can see where it's all stuck. It's almost like a pinch. It's
Looks like a pita bread.
yeah, yeah, it does. Yeah,
A taco.
a taco.
It's a forbidden taco. There you go. That's what it is.
Oh goodness me! We've managed to peel it quite nicely so far, but I cannot get this last bit to peel. Trying everything here to get this to come away, but we're really, really struggling here to get this. Now, we may consider with some patients in this case where you've got this really hard, like thick skin, especially when it is quite tough and it's all stuck like this. We may suggest to the patient of coming back for a follow-up, and we'll usually get them to use a slightly more aggressive drop just to try and soften it a little bit.
Yeah.
Or just to loosen it a little bit more than anything. But it's always typical that these cases where they're a little bit more tricky to do. The patient's always got somewhere to go, or they go on holidays and they can't come back, and so you just kind of have to persevere with it, really.
You kind of got it's a difficult place to use a set of forceps in because it's so close to the eardrum now.
Yeah. Oh, still.
And you've got a little bit of a lift then.
Yeah,
I don't know whether it was a tear or a lift.
Oh, you can see it's like pulling and then going back into the back into that position. Oh, sorry.
See with this, I would like for this. I would just be flooding this. There would be just like a swimming pool of oil in there now.
I should have.
Well, I don't. It's personal preference as well. Like I tend to like if I go this one, I'll just lose loads and loads and loads and loads of oil. But it doesn't always make a difference when it's skin. If it was wax, I would say yes, it would make a difference, but it doesn't always when it's skin.
Now you can see I did try the standard size Zollner tube there, and I've switched back down to a fine end, and you can see it was really quick. I went in and came back out because it did start to clarinet. It did start to whistle quite loud, so we've had no other option but to use the smaller tube.
Yeah.
The problem with the fine end, it's so small. Even though you're technically using the same power suction, the area is so small you don't get as strong of a grip, and you cannot get that strong hold.
Yeah.
And it's literally fighting us with every inch of its life. This is like these forceps. When we get a good grip, we are putting not an immense amount of pressure, but we are pulling this. And it is just not going anywhere.
It's anything. It's just tearing, isn't it? It's almost like that last piece of skin that's down the recess there is hanging on to that drum. So I think you've switched up. I think you've done the other ear.
I've probably gone over to the other side now, just to mix it up a little bit. Give me a break from that one side. You can see there's a little bit of almost like a scab at the bottom there. I think the patient has had a little bit of a go with the cotton bud, I believe, because his ears have been like super itchy with.
I was going to say this would have been itching like Billy, wouldn't it?
Again, it's quite tough. Like you see how hard it is.
It's almost that brittle kind of skin, isn't it?
Yeah. Yep. Or is it this one I managed to clear?
I think you definitely managed to do one. The other side is looking more familiar to me, so I think I probably came and give you a bit of a hand on the other one as well. Because it does, your arms start to kind of ache after a while. Yeah, I would have gone for that piece. Look at that.
Yeah, you're literally just kind of free holding your arms in the air for like 20 minutes at a time, Oh.
It's a perfect place to grip, isn't it? It's actually quite nice because it's peeled away from the one side of the canal wall. I was thinking about this gent's probably due in soon.
Yeah, it would be, yeah. Yeah, this procedure you're watching now, we would have done this roughly in the summer, so about 6 months ago.
Look at that. Well, you're getting a nice peel there. Maybe if you can get the, I was going to say, maybe if you can get the bottom jaw of the forceps underneath, but probably flattening it out might be a better start to peel on the drum. There you go, and then grip it with the foot. Yeah, there you go. That's actually a better option. I'm going to do it that way.
Oh, gently. Oh, you can see it's all starting to pull away.
You can really see that going out. Oh. It's getting there.
I was a little bit kind of cautious about where that little scab was, because sometimes if it's got that harder, you know, scab over the top, and then you're peeling that skin, and then it kind of re-breaks the surface, you know, there's a risk that, you know, it could bleed again. Yeah, so that's why I was a bit kind of worried about. But I think it came away quite nicely.
Yeah,
I
it
think
looks like it's lifting.
Yeah, I think it was an old scab. Just trying to peel this front section away.
Yeah, you can see it with that hard skin has gone over the top of it. That's sort of like an old trauma to the canal, that one, isn't it?
Yeah.
How hard that is, though.
Oh, solid, absolutely solid. Like I said, I think this was the first visit that we saw the patient, because we did suggest you know, continued use of olive oil, because the patient hadn't really been using any up until the point of seeing us. But I don't think there was any that was used on the second appointment either. It was exactly the same.
Yeah.
Oh, here we are.
Some people don't like the sensation of it, do they?
No.
And you know, unfortunately, it's the ones that a lot of the time I don't like the sensation are the ones that really should have used it. Really needed to go in. You have the same problem here, don't you?
I think so.
We can see it's all kind of, it's exactly the same, both sides hanging on to that edge of the eardrum, just into that recess.
Ooh, don't push it back down.
I know.
Again, just trying to lift. I need to try and find an edge that I can kind of grab here. And I could probably go in and grab that little bit in the center with the forceps, but I want to see if I can loosen this bottom section first.
That's a hard section to hold on to.
Yeah. So we have put a bit of oil in here, see that's where that wetness is underneath. That's the oil that we've just popped in.
The problem you've got now is you're lifting up, but you're in that room because you're going to hit the eardrum.
Yeah. Tricky.
Not easy, is
Tricky.
it? Not an easy one to do.
Oh. So this is the standard size on the tube here now, so I'm trying to get that better grip again with that flatter section you can see there. Oh.
It's really peeling across there, isn't it?
Mm. Trying everything to get this out, because bless him, he was really, really struggling. Ooh. Bit of a wiggle in. I don't.
That's not what you want to see. He's almost there.
We've obviously left it at this point.
So this. I think this is the first visit, isn't it?
That's the first visit. Yeah. So they came back for a follow up to see yourself. Then I think was it.
So we got an inch and I don't know what inch and 9/16 or something. So this is after using oil for a little bit of time. You can see it's very, very humid in here. So I'm just psyching myself up. I'm just taking the easy bits out first. Okay, so let's have a little look then.
So it's kind of interesting, because you don't usually see us posting the videos where we haven't actually completed the wax removal.
No.
But we thought we'd be interested in this case just because you can see the difference kind of before and after.
Yeah.
You know, and again, patient has used a little bit of oil, but I just don't. If I can remember, I think the patient only used like a day of it or something.
Yeah,
Just like
I think
didn't really use.
we normally say to people, if we're getting them back, it's normally a minimum of a week, isn't it? We
Yeah.
can say, use oil for a week, come back, and then make it a bit easier. But a lot of patients will just go, oh, well, I did probably then, but I only put them in yesterday. And you think, well, it's not, you know, it doesn't really make much of a difference really to especially with skin, because you need that oil to absorb into it to soften it a little bit.
You can see it's pretty much the same as the first visit we've got.
Yeah. I think I'm eyeing up that little kind of flap there, I think, as possibly a forceps. It almost looks like, remember Skip's crisps? It looks like an upside down Skip. Almost like a prawn shell crisp it is over here in the UK.
Is that going to be a good enough? Ooh.
There was a bit of a peel there.
Yeah.
You can see I'm really kind of holding on here, trying to get that last little bit. So I don't want to press against the drum at all.
It's almost like it needs to go up.
Yeah.
Straight up, isn't it?
You can see I'm looking for a gap. Now that's the piece I thought I would have originally gripped.
Oh,
there it goes.
Here it comes. Look how deep that was.
All the way out.
Look how long that recess was. That's.
So you can see now why we were having so much difficulty lifting that out the recess. You can even see it brought a load of. That's not all of it as well. There's another. You can see patient jump there because I got a bit whistly towards the end there. But
I'm sure it's so much better as well.
Oh god, yeah, when that's gone. Look at the other side though. It just looks like we haven't done anything on the other side, isn't it? You know, and you can see how much we took away after the first visit because we marked it up there.
Oh, it's exactly the same both sides. Really, really deep.
I know. I'm trying to work out the best place to start on this because it's laying so flat against the eardrum there. I know every time you pull this down, you know what's going to happen is that it's just going to go back up again, exactly where it was. Is this bottom section the sort of linchpin piece then? Are we going to be able to, having already now seen how deep that recess is, yeah, it's whether you'll be able to get a forceps under that, to that right corner there. That's where I'm eyeing up, I think.
Yeah.
Oh no, I got the other way. I thought it was eyeing the other corner up. Oh, it's got a tiny, not enough of a grip, but it's got a tiny grip there. The problem you've got is every time you try and get that bottom jaw in, it just folds it upwards, so you can't get the top jaw over the top.
And you've got to be really cautious about touching the ear canal in that area as well. Obviously, it's super, super sensitive.
You can see I'm trying to lift that bottom, but instead of it sort of lifting enough to get the forceps in, what it's doing is lifting like this, and you can't get the top jaw over it. Okay, so I've turned the forceps upside down now to try and grip this one corner. I'm trying not to touch the canal wall, but...
Oh, that's a good grip.
Something started to pull then.
Yeah.
There we go. Absolute beastie.
Yeah, like I said, it was surprised. You can see, you can't even see the full eardrum properly. It's so deep that it's... Oh,
it's a kind of perfect storm. It's a very pronounced recess. We can see how long it is there. I'm trying to show you the inside of it as well. So you can see it's almost like a thimble or a sleeve inside the canal there. So there we go. So
2 perfect casts.
that's it. So I took out 1 inch. Taylor took out, was it 5.5 centimeters, which was, what's that in inches? About two and a bit inches.
Yeah.
There you go.
You made it.
It did. It felt like a long 3 days of Waxvent the voiceover. That's a long video. Well, guys, thank you very much for watching the video again today. Hopefully you stuck to the end as well to see the ruler shots at the end. If you do enjoy the videos, don't forget to like, heart, share, follow, and subscribe for us. And if you thoroughly enjoy the videos, you can also consider becoming members of the channel. That way, then you get to see even more videos every single day. But guys, until the next time, as always, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and the lovely Miss Taylor. We will see you tomorrow for day 4 of Waxvent. Bye, everybody.
Bye-bye.